Welcome back, everybody, to New Day Northwest. When a couple decides to start a family, that little plus sign on the pregnancy test can't come fast enough. So when it takes several months or even years to become pregnant, it can be painful and it can be also very frustrating. So today, to talk about this, we're joined by Medi Folio, who went to Seattle Reproductive Medicine after trying for a baby for 9 months, and Dr. Nancy Klein. Welcome back, Dr. Klein. How are you? Can I call you Dr. Nancy?
Oh, yes.
That feels more personal. Medi, you had tried for how many months before you decided to seek help?
About 9 or 10 months.
And were you feeling like something was wrong, or were you just at that point thinking, listen, let's get to the bottom of this before we spend any more time?
Yeah, I probably thought I just didn't know enough information, so nothing was happening, as I could say. So, and people around me were getting pregnant and things like that, so I thought maybe I should ask the experts.
And that, you know, that happens. As soon as you have trouble having a baby, it seems like everyone in the world is pregnant at that point. So, Dr. Klein, what kinds of tests did you run, and what happens in a case like Medi's? I mean, it hasn't been forever. It's not like she came to you and said, I've been trying for 5 years.
Right. Well, for Medi, there wasn't anything obvious in her history, and she wanted to be proactive and wanted to get all the information. So we just did a basic fertility evaluation for Medi and her husband. And for his part, it was pretty easy. Just did a semen analysis. And
men generally don't mind this whole process. That's I'm just saying.
And generally, for the semen analysis, you know, if it's normal, then they're kind of done. That's the main test that we do.
Right.
And then the rest is focused on
for Medi.
Medi.
Now, you ran a test called an ovarian reserve. Is that how it is referred to? What does that do?
Yeah, so when we talk about ovarian reserve, we're really referring to the egg supply. Women are born with all the eggs they're going to have, and as they get older, the number of eggs goes down. And so Medi's young, she's 31, but even by the time a woman is 30, the number of eggs may differ a lot woman to woman. So by figuring out...
Why is that? Because aren't we all born with like 400 eggs or so?
Well, we're born with lots, with actually hundreds of thousands of eggs.
Really?
Yeah. But that probably varies. We're just, you know, genetically different, and also we don't know what controls the rate they go away. So some women, you know, may lose their eggs faster for some reason. So by the time a woman's in her 30s, she may still have a huge number of eggs, or she may have a supply that's getting lower.
And you can actually tell.
So we can, we can look at ovaries by ultrasound and see how many of the little resting follicles are there. That correlates really well with how they compare to other women their age. It gives us an idea of window of opportunity. And we can also do blood tests.
Okay. Uterine function. How do you test for uterine function? What are you looking for?
So for the uterus, we look just at overall shape. We look at ultrasound, make sure there are no fibroids or any congenital abnormalities at the shape of the uterus. And we can do an X-ray test called an HSG, or Hysterosalpingogram. And hystero is the uterus part, and that's a test where we put dye in. We can see the inside shape of the uterus, and we can also make sure the fallopian tubes are open.
What's the salpingogram part of that?
That's the fallopian tube.
That's okay. All right, very good. And the blood tests tell you what?
The blood tests are mainly looking at hormonal function. One of the things for Medi was she was having some irregularity and had that all along, so she was a little worried about that. So we did a test to make sure that she was ovulating. And we also did just some other hormone tests like thyroid and prolactin, which is one of the hormones that's made by the pituitary that controls ovulation. Make sure there were no underlying medical issues.
This all seems so easy until you start looking into it, and then you think, how does this possibly work? There's so many little X factors. What was it like to go through the test? Was it difficult, or was it fairly easy?
Oh, it wasn't difficult at all. They know everything that they're doing so well there, and they're so organized, and so they tell you exactly when to come in, what days, and so you just come in those exact days, and they kind of get you in and out, and they're real helpful and nice. So.
And have you finished all of your tests?
Yes.
Results are in?
Results are in. And so far, everything has looked great, very reassuring. She has beautiful ovaries, beautiful uterus, gorgeous fallopian tubes. I thought maybe we were going to show a picture.
Gorgeous fallopian tubes.
So,
you knew.
Thank you, God.
But we did, you know, we are going to focus a little bit on trying to get her cycles more regular, because even though she ovulates, it seems a little unpredictable on a given month when that's going to happen. So we're going to probably use a little medication to try to shore that up a little bit.
So what is that like emotionally, to have at least this much information and a plan going forward?
It feels great. I mean, it feels, you know, like there's something happening. As before, you sit around and kind of wait, and they tell you you should wait a year or, you know, wait 2 years to find out. But I think for me, it was nice to know earlier, because then you can move on.
Have a game plan.
And get started if you need to get something going. How long should we wait before we come in to see? I'm not a good waiter.
Well, it depends. I mean, in general, it can be normal to take up to a year to get pregnant, but things that should prompt an earlier evaluation would be if the woman's over 35, or if there's anything in the history like irregular cycles that suggests that there might be a problem from the beginning. Some patients come in right away because they know they never ovulate, for instance. And I think if a woman is anxious, there's no problem. We even have women who haven't tried to get pregnant yet, who aren't ready to get pregnant yet, who may just want to come in and just get some basic tests so that they can plan and they're not surprised.
Right. And feel good about knowing everything's going well.
Ready when you need it.
And that they have gorgeous fallopian tubes also.
Right. That's right.
Dr. Nancy, do a good job for her. We want you to come back and show us your baby here in about a year.
Thank you.
Yeah. All right. Thank you so much. If you'd like to learn more about Seattle Reproductive Medicine, or if you'd like to schedule an appointment, you can visit our website at king5.com/newday for a link. We'll link you straight over. Now, when we come back, we are kicking off Spa Finder Week. If you needed to find a good excuse to get pampered, we have a few ideas for you, including some huge discounts to find out about right after the break.